Alright guys, so this video is about the internal carotid. I just want to start by saying that everything you see in this video was made to be schematic for you to hopefully be able to visualize it. Now, essentially, as the common carotid artery ascends along the neck, it will divide at the region of the upper thyroid cartilage into the external and the internal carotid arteries, with the external carotid here in orange, as we're not really going to talk about this one. Now, initially, the internal carotid is divided into 4 anatomical parts. However, in a clinical setting, and this really depends on the source you're studying from, you may find it divided into 7 anatomical segments. I will go through the 4 anatomical parts, but I will also show you the 7 segment scheme later in this video. So the first part is the cervical part in the neck region, hence the name cervical part. It goes up and then it goes inside the carotid canal, as you see here, where it now becomes the petrous part. So if we take this area out and visualize it a little bit, you will see the carotid canal here. It's initially a canal within the petrous part of the temporal bone. So this is just a coronal or a frontal section of the canal. Now the internal carotid will continue up through the canal, and then it will give off some important side branches, and they're called the carotico-tympanic branches, supplying the tympanic cavity or the middle ear. Now, as it leaves the canal and enters the middle cranial fossa, it becomes a cavernous part, and here's maybe a better representation of it. It goes right through the cavernous sinus. The cavernous sinus is one of the dural sinuses of the head. They're huge, they're large veins draining blood from the brain and then sending them down mainly through the jugular vein. And this is how it, you see it going through the cavernous sinus. That is why it's called the cavernous part, because it goes through the cavernous sinus. And then as it goes up, it eventually gets the name cerebral part, where it is divided into 5 terminal branches. Now, I mentioned earlier that it could be divided into 7 segments, and I'm not really going to spend too much time on this, but I made a quick scheme of the 7 segments with the side branches of the internal carotid. I mentioned the carotico-tympanic branch, but as you see, there are specific side branches for each segment, except the cervical segment, lacerum, and clinoid segment, I guess. C1, C3, and C5. They're without side branches. You can just pause the video and take a mental picture if you wanna, but I essentially want to focus on the terminal ends of this artery, because those are the most important ones. So, looking at a cranial view of the cranium, we're going to have the ophthalmic artery going into the optic cavity through the optic canal. Then there's the anterior cerebral artery, which communicates with the other one on the opposite side through the anterior communicating artery. There's the middle cerebral artery. Then there's the posterior communicating artery, which communicates with the posterior cerebral artery, here in red. The posterior cerebral artery is a branch of the bacillary artery, as you see here, which initially comes from the vertebral artery, coming from the subclavian artery. So now the last branch is the anterior choroid artery, which enters the lateral ventricle, and then it forms the choroid plexus. Now, I will try to cover these arteries in a little more detail, or rather just enough for you to gain a general knowledge and hopefully pass your test with a comfortable grade. All of these form the so-called circle of Willis, which supply a huge majority of the brain with blood. Its name is after the English physician Thomas Willis, who in late 1600s researched the anatomy of the brain and found the structure of arteries. So let's look into each of these. Again, the major blood supply of the brain comes from the cerebral part of the internal carotid and the basilar artery. The ophthalmic artery does not provide any blood supply to the brain, and so to save time, I will go through this one when I talk about the blood supply of the eye in a separate video. But the first one in the list is the anterior cerebral artery, which again has this anterior communicating artery, which communicates with the anterior cerebral artery of the opposite side. Now, essentially, this artery will run along the longitudinal cerebral fissure, as you see here. And this, if you look where the arrow is and then follow the artery, the whole purple area will be supplied by the anterior cerebral artery. And this includes the whole medial surface of the frontal and parietal lobe, as you see here. And then on the superior lateral surface, the whole blue area on the top is supplied by this artery. That includes the superior frontal gyrus, the superior parietal lobule, and the upper part of the pre- and post-cerebral gyrus. Also a little hard to see here, but it also supplies a straight gyrus or gyrus rectus on the inferior surface. So that's this one. Next is the medial cerebral artery. This is a huge artery supplying really most of the brain with blood. Therefore, any blockage here will lead to something called middle cerebral artery syndrome. And this is quite serious because you see here how it supplies many structures in the brain. It supplies the insula, the lentiform nucleus, the caudate nucleus, the internal capsule, along with the superior and the middle temporal gyrus and the rest of the purple areas in the brain here. That's why the middle cerebral artery syndrome is associated with many symptoms like paralysis, sensory loss, and speech problems, mainly because Broca's area and Wernicke's area is also affected. So that's mainly all I had for the middle cerebral artery. Next, we can jump over the posterior communicating artery because this just goes back and communicates with the posterior cerebral artery. But the anterior carotid artery is very important, and I try to visualize it here. So again, here's the internal carotid with the anterior and the middle cerebral arteries. The anterior carotid artery will go backwards to form mainly the carotid plexus in the lateral and the third ventricle. So that's mainly this one. That's mainly all I had for this one. Now, the next one is the posterior cerebral artery, coming from the basilar artery to supply mostly the occipital lobe, as you see here in yellow, as well as the inferior temporal. And remember, both the occipital and the inferior temporal gyrus are both associated with vision. So any occlusion in the posterior cerebral artery will result in visual defect, along with other significant things like pain and temperature sensation loss. So that's mainly all I had for the internal carotid and the blood supply to the brain. I really hope this video helped you in any way. Just as long as you remember the circle of Willis, you're already understanding a huge majority of this topic.